May I request you to stand up? Thank you.
Vande Mataram, Vande Mataram, Vande Mataram, Vande Mataram, Vande Mataram, Vande Mataram. Sujalam Sufalam Malayaj Shitalam Sashi Shamalam Mataram Vande. Sujalam Sufalam Malayaj Shitalam Sashi Shamalam Mataram Vande. Vande Mataram, Vande Mataram, Vande Mataram, Vande Mataram. Vande Mataram, Vande Mataram, Vande Mataram, Vande Mataram. Shubhra Vande Mataram, Vande Mataram, Vande Mataram, Vande Mataram, Vande Mataram. Sapt koti kant kan kan ninad karle, ne sapt koti vijay hai sar katwale. Sapt koti kant kan kan ninad karle, ne sapt koti. Vande Mataram, Vande Mataram.
Thank you, sister. May I request for those standing outside, please come inside and sit down and have your seats.
Ladies and gentlemen, on behalf of Choithram Hospital and Research Center and Indore Orthopedic Association, I have a great pleasure in welcoming you today this afternoon. We are most grateful to Dr.R.C. that he spared his time and very kindly consented to be the chief guest this evening, and Satish Motiani to inaugurate this function. We are equally grateful to Professor C.P.Tiwari to come to the afternoon and be with us. We are very fortunate in having eminent faculty members and who have come all the way from USA, Bombay and Pune. Dr.R.C.Ranwat, Lawrance, Dr. Robert Porters, they come all the way from States, and we again welcome Dr. Sancheti, who is part of us, and Dr. N.S.Laud from Bombay. They have come this time also to conduct this show. We are very happy. A large number of delegates, nearly 80 of them, have come from various parts of this India and various states. And I welcome them. I'm sure that they'll find their stay pleasant. And I'm most grateful to our colleagues from Indore who have come down this afternoon, and our well-wishers who have come this afternoon to meet us. Thank you very much.
Request head of the department and the chairman of this workshop, Dr. H.Sahni, to welcome the chief guest as well as the guest speakers and introduce them to the audience. Dr. H.Sahni, please.
The most pleasant task of introducing our chief guest for the evening, Professor T.H.Sahni, and eminent visiting orthopedic surgeons from different parts of the world. It is also an extremely difficult task, since the achievements of such luminaries would take the entire evening to enumerate, but I shall make an effort, and for any omissions, I seek their apologies. We are most thankful to you, Sir, Professor Ohri, to be with us this evening. Dr. Ohri is the senior-most surgeon, not only of this town, but I think this part of the world. He was born in 1909 and graduated from Lahore Medical College in 1931. He obtained his post-graduation in 1936, and in 1938 he came down to Indore and has held several coveted posts. He obtained his fellowship in 1947, and he was the first professor and head of the surgery department at the Medical College Indore, and then was the dean, given training by him, and the others have received training by people who have been welcome Dr. N.S.Laud and our course director. We are proud that he is the only Indian to have been honored in this manner. He is one of the leading authorities on total joint replacement in the world today. His involvement in treatment of the patient and education of medical professionals is so intense that whatever symposia have been held in this country, he is the most sought after speaker. And we are proud and honored to have him amongst us this evening. His belief in getting relief to the crippled has helped us in getting a very generous donation of instruments, implants to the only example of an Indian having made tremendous progress abroad, who continues to remember his hometown and countrymen by bringing tools, technology and the technique shall be fulfilled to the optimum. Now I have great pleasure in Dr. Lawrence Dorr is an eminent orthopedic surgeon from Los Angeles, California, United States. He has done extensive work on total joint replacement of hip and knee and is at present the attending orthopedic surgeon at Centinela Hospital, Los Angeles. He is also attached to the University of Southern California. At present he is working on a new non-cemented hip prosthesis, which would be a boon to those younger patients who are in need of a total hip, but the surgeons at present are a little reluctant to perform surgery on account of the possible complications of cement. He is a very friendly person and has a very hearty and big laugh and seems to enjoy every aspect of life. This is what I noted this morning when I was with him. Thank you for your visit, sir. Now I have great pleasure. Dr. Robert Porter he has done extensive work on hip traumatology. Incidentally, Dr. Dorr and Dr. Porter are childhood friends. And it is a strange and pleasant coincidence that these two great childhood friends are participating in this symposium and are sharing the same platform this afternoon at Indore. Both of them have been with Dr. Ranawat during their senior training programs. It is indeed our pleasure to welcome you, sir, and hope that your stay at Indore is a very pleasant one. Dr. Science of assessment and rehabilitation in 5,082 handicapped children, and which he selected from 100 in the country, which also has a very big academic wing. Despite his great achievements, you will find that Dr. Sancheti is humility personified. Now I have special privilege and pleasure in introducing to you my old friend, Dr. N.S.Laud, popularly known as Nandu, Dr. N.Laud from Bombay. Now how do you introduce a person who is part of Indore, who is part of you? But he qualified from Indore Medical College. At present he is the Dean and Professor of Orthopedics at LTMG Hospital, Sion. He is the Secretary of Indian Society for Surgery of Hand. He was selected as an international scholar by Cleveland Clinic and Foundation and is a member of Bone and Joint Committee, Federation of International Societies of Surgeries of Hand, United States of America. He has been a constant link man between us and the visiting dignitaries from the United States, and most of the credit of conducting this workshop and symposium at Indore goes to Dr. N.Laud. He has been a constant help, and whenever we send an SOS to Bombay, he is available, and we are grateful to you Nandu, for spending most of your valuable time in organizing this workshop for us. Thank you very much.
I don't know what I'm talking. Ladies and gentlemen, I think we are most fortunate in Indore to have still with us Dr.R.C.Varma, Dr. Mukherjee, who are very highly respected and prominent personalities in their respective fields. It is the most great thing that their student, Dr.R.C.Ranwat, who having achieved such international fame, is devoting, is sacrificing his efforts for updating and for bringing in high technology, high modern medical technology to Indore and putting and bringing Indore on a world map. There cannot be a better tribute thus being paid to these two prominent personalities of Indore, that their dreams are being fulfilled in their lifetime, which very few people can even think of. We in Choithram, having the desired inputs and the will, have tried to act as a channel for receiving these high technologies and subsequently transferring it to other medical institutions. It is really most gratifying that Dr. C.P.Tiwari, Dr. S.K.Ohri here are joining hands with us for making Indore one of the most modern medical centers of the country. We surely look forward for that day when they'll be operating in Choithram. I'm certain that the assistance and cooperation will help us in starting postgraduate training for super specialties, for which the inspection team has already come from Pune University. This venture of hip replacement surgery in a grand scale, was conceived by Dr. Ranwat, for which all the material help was given by Mrs. Johnson & Johnson in a big way. And our friends in the United States, as well as in India, have been a great source of inspiration for us. We'll not only work hard for bringing in these technologies, taking its firm roots in Indore, but also look forward for other joint replacement surgeries to come down in Indore and blossom for the benefit of the patients.